You do?
I feel tall.
Do you feel tall?
I feel very tall.
I don't know if either of us has ever really looked tall.
Just feeling it.
Every now, like sometime with mules on or something.
Oh, there's Cassie.
Oh, Cassie's the winner today.
Good job, Cassie. I think so.
All right.
And Joyce and Kim.
And me.
And Destiny. All right. All of our friends and family and some strangers, but that's okay. They'll be friends soon. They're all coming to join us. We're just going to give it another minute before we get started, and then we will go from there. Thank you guys all for joining us. Hello, Faye.
We see you, Brian. Brian Merson.
So we see you. We actually have a special camera in your home, Brian. You just don't know it.
Yep.
But now everyone does. Hello, Barbara.
Happy Tuesday to you, Rita.
And hi, Jackie. People are so nice.
They are.
Love it. Put that here.
Sorry, Kim. I didn't pack my shirt today.
I know. I've got my virus one on, but we don't have new shirts today. Don't be sad. We have to work on other things, other sayings.
We do.
Mm-hmm. We've got quite the collection.
I think we should have that Frozen picture of us.
Right? Hopefully everybody liked the Frozen picture today and the Batman and Robin one last week.
Mm-hmm. There's more to come.
Yes, we definitely have a whole supply of them ready. All right. Yay, got threes. What's that?
I don't know.
Even Brian, you have to translate that one. Hey, Nancy. Howdy, Phil. Good evening, Barb. All right, we've got about 50 or so people on here, so we'll go ahead and get started. So again, as usual, if you're not sick of us yet, and if you haven't met us, that's fine. Nice to meet you. New friends. Jason Wheeler, he's on here too. I'm Jen Bacani-McKinney, and I'm the Wilson County Health Officer.
And I'm Destiny Wheeler, and I'm the Health Department Administrator.
All right, no new t-shirts today, but we will work on them for next time. So if you catch anything really, really enlightening that we say today, or ridiculous, actually all of that stuff goes on t-shirts.
Yes.
Please let us know, or feel free to vote on anything that we've said in the past that you think would make a good t-shirt. So we'll let audience participation be part of this, and we'll come up with t-shirt ideas that way. So as of now, we have people actually up in some of the urban areas that have t-shirts which were made by Shelby Smith, and words, very, very important words of wisdom by Jen and Destiny, or Justifer. Wait, Destifer.
Destifer.
Or Jestiny.
Or Jestiny.
Yes, that's what we came up with. All right. Okay, so we always start with statistics, so we're going to talk statistics.
Yeah, so as of today in Kansas, we have 5,458 positive cases since the beginning, cumulative positive cases, and 137 deaths, and that is up from yesterday by 210 cases and 1 death.
All right. And then, do you want to talk other numbers yet? Not really.
Not until I clarify.
Yeah, we'll clarify later. All right, so the big topic, of course, I don't know if you guys noticed, but the stay-at-home mandate is up, and so that's a big deal. And what we did was, and we talked about this last week, but Destiny and I have been working with businesses and churches and governments and all that to try to figure out what would be the best way to put more detail to it as far as what Wilson County looks like. And most of the counties across the state have done something similar. Most counties weren't just like, all right, here's the state mandate. You guys decide what that means. Good luck. Because we know what Wilson County is, and we know what businesses are here and services are. So we wanted to really make sure that everybody was on the same page. And one of the biggest things for us is we want it to be fair for everybody. We know that COVID-19 is not just a physical illness, but people are struggling mentally. We know people are struggling financially, and the economy is struggling as well. And so we want to be very sensitive to all of that. And we want you to know that those are all things that we took into account with the reopening plan for Wilson County. So we're going to actually wait for you guys to ask questions, and while we're doing that, we are going to go over kind of the guiding principles of what what we believe should continue throughout the different phases of reopening, and then as questions come along, then we will answer those. So you might have specific questions about your own business, about somebody else's business, getting all up in somebody else's business. I don't know. This is a small town. It's what we do. So if you guys have questions, please throw them out there. Do you want to start us?
I've had a couple people say they've lost us.
Lost you too?
But I think,
Oh, you are not online.
I wonder if
Can you guys give us a thumbs up if we're still on?
we don't want to waste our time here if no one can see
Oh,
us.
that's right. Let me do this. Because I don't... Oh, connection available? Are we connecting? Okay.
Oh, now we've got, like, the words are back, so maybe
Oh, that's good. Can people see us?
going again.
Okay. All right. I see some thumbs up. Give us some more thumbs up. Let's see. We did use it is ironic. We did use Frozen as our, oh, we're such dorks. This is my own fault.
It is.
Because I thought it'd be funny that we were Elsa and Anna.
She was too free with her puns.
I know. Every time. Okay, so
Okay.
we're seeing that we're back. Okay, so
Sorry about that.
There was, if you remember, one time I let my phone die. This time I didn't turn on Wi-Fi.
One time we couldn't get it to go sideways, and we
Yeah.
were like squished together like this.
Yeah, one time we were sweating a lot. That wasn't a technical problem. That's a 40-year-old problem, almost 40-year-old problem.
Yeah.
So, okay, thank you guys for sticking with us. We see that we've got 70 or so people on here. So awesome. Thank you for the feedback.
All right. Yes.
Okay, as we were saying, reopening is kind of the biggest thing right now, and so we are making sure that everybody feels comfortable with reopening. You may have already heard this. I don't know when we cut out, but we want to make sure that everybody has their questions answered. Maybe it's your own business, maybe it's your own travel, maybe it's somebody else's business. As we mentioned, you can ask about other people's business, get up in other people's business, and just keep asking away. We want to make sure everybody's on the same page.
Oh, we're still getting an Emmy.
Oh, thanks.
Thanks, Diane.
So we're going to start with talking about the guiding principles that we believe that people should follow through all of the phases. We have 3 phases in the Wilson County Plan, which is the same as the state plan, and some of the guiding principles are the same throughout. And one of the biggest things that we're going to push, whether people like it or not, because this is one of the easiest, non-invasive, meaning like it doesn't hurt anybody, but easiest non-invasive ways to help each other and protect each other is to wear a mask. Proven around the world, proven time and time again. And people, the thing that we have heard is really the only negative thing we have heard is I have the right to not wear a mask. Well, sorry, go ahead.
Or they're just plain uncomfortable,
Yeah.
and they are.
Yeah.
And they fog up your glasses. I
And they're no
get
fun.
it.
And when we say mask, like some people might say, well, I don't have a mask. Well, a handkerchief or a t-shirt, like a piece of a t-shirt tied around. It doesn't have to be anything fancy at all. But really we're asking each person on this Facebook Live, within your networks, at your church, at your business, at wherever you are, we're asking everybody to reach out to those people in your networks to say, hey, it's important to me, as in you guys, it's important to each of us that you wear a mask, because it's really not about the discomfort. It's not about the right to not wear a mask. At this point, it's the right for people to be out and about and to be able to feel safe when they're at work, at the grocery store, or anywhere else. Someone asked, where's our mask? We don't do masks during this Facebook Live simply because it is hard for us to hear.
You wouldn't be able to hear us.
When we leave here, we have them on. Before we get here, we have them on. So thank you for holding us accountable. We hope that that's always the case.
Yeah.
Okay, so how do we educate folks to wear masks when out and about? And yeah, we've already started with that. So please do. I mean, plan on reaching out to other people, because we're going to have to do it together. There's been a lot of pushback about mandating mask wearing, and so believe us, we've discussed it, and we would like to be able to say everybody has to, because we want everybody to protect each other, but that is just not the case at this point, so that we're able to mandate it. So with that, we are going to start with guiding principles.
Sure.
Do you want to start with this stuff? Because I think that is like really good information.
Yeah, sure. So, so the guiding principles of our reopening document the state must allow for the actions included in each phase, which means that the state has set a standard. We can be more strict, but we cannot be more lenient. And that truly happens like down the hill, as you would think that the state sets the standard. We can be more strict. If we're not, businesses can be more strict. So while we can't mandate masks right now, a store could. They could say you can't come in, or they could say their employees can't come to work without one. Those are options. But as far as this goes, we cannot be less strict than the state. To move from one phase to the next, all of the following criteria must be met. So local indicators must show decreasing or stable transmission, or we know we're at 0 right now. It's really hard to maintain, well, it'll be hard to maintain 0, but it would be really hard to decrease from that. So we expect there to be some cases, but we expect them to happen in the same rate that they're happening all around the state. If we are going way up, way fast, then we're definitely probably.
Yeah, no, that's definitely probably.
We're definitely probably not going to move to the next phase if we're seeing a real spike in cases. Each phase is at least 14 days long. Because of that incubation period, if people are going to start showing symptoms and getting tested, then it'll be generally within that 14-day period. So it puts us just a little bit ahead of the virus. Sufficient testing must be available, and it is.
Oh, it is.
It is.
So in Wilson County, right now at Fredonia Regional, but we are working so closely with Wilson Medical and the surrounding hospitals, we can get testing done within a couple of hours. And we say that because if you have multiple tests lined up, each test takes an hour to run. So it might take a couple hours for your test to be run. But how exciting. We are one of the few small hospitals, especially in all of Kansas, that are able to run tests in a matter of hours versus
In-house.
days in-house. Yeah. So our lab is actually running them. So super cool. We're so proud of our county and proud of the people who are making sure that we have the supplies and we have the testing that we need. So thank you.
Mm-hmm. Where am I at? Oh, sufficient hospital protective equipment, personal protective equipment must be available, which it is. We have plenty as of right now. And hospitals must have the capacity to treat an increased number of COVID-19 patients requiring hospitalization. So that one is very important because we know that hospitals aren't just going to be treating COVID-19 patients. They're going to be treating all of the patients that they would be treating anyway. So how many beds do we have in the county?
We have 40 total, 25 here and 15 at Wilson Medical.
Yeah. So, if we already have 30 people in the hospital for something random, then we can only treat 10. I keep thinking there are 45.
Mm-hmm. This is not your math education.
Real good.
Destiny is homeschooling her children too. Not a big deal.
It's frightening. But so we'll only be able to handle 10 COVID patients in-house, and it depends on what's going on in the hospitals around us, whether we can move those patients around and do things. And the hospitals are working together regionally to best use their space. Mm-hmm. And the public health system must be able to promptly identify and isolate infected individuals and identify and quarantine necessary contacts, which, like, again, we have Kara, who is amazing at the health department, and then we have Jeanette, who can back her up, and we even have a couple of people in the office that can take on those responsibilities also. KDHE has made available to health departments some remote contact tracers, people that can interview people if we don't have the staff to be able to do that.
And I think a good example of that is like out at the meat packing plants in Ford and Finney and Seward County, where they got so overwhelmed so quickly that they needed help brought in to be able to say, okay, so this guy tested positive, who all has he been around? And you can imagine in a meatpacking plant, and then families that are close to other families that might eat together, or spend time together. It was really a lot of work and it still is a lot of work to try to be able to contact trace each of those people that those people were in contact with. So they reached out to the rest of the state to say, hey, can people help us out? They specifically needed Spanish-speaking people at the time to be able to help with contact tracing. So that's what all this is about, with being able to do like the contact tracing and follow up on everybody.
Yeah, and I do want to thank the few of you that sent me names and numbers. I didn't contact those people because I got feedback from the state that said they wanted health department employees that were already trained to do that. So they didn't have the training capacity at that time.
It's so nice though.
It was so nice. Yeah. Yeah. So people are willing to help a lot.
So some of the other things, and we are getting some great questions here. We also have people from our wonderful county, all around the surrounding counties, the state, and Michigan, England, and the Philippines. So looky there, we've gone international again. Good stuff.
And Canada, I saw Canada.
Oh, and Canada, yes. So we still are recommending that when you go out and about, it's really only hopefully for essential things. We don't necessarily, it's not kind of a free-for-all to say, hey, let's have a big party, or hey, let's just go out and just be out because we can be. We know that people want freedom, and that's okay, but still the safest place is staying home if you can be home and if you feel fine being at home. Social distancing should be the same throughout. 6 feet, again, even though it's not like a magic number, it's what we have found in science to say that droplets have a harder time reaching the other person from 6 feet away. That's why we need to do that. And then try to interact only with people in your cohorts. Destiny does a great job of explaining cohorts, family groups and
people that you're around all the time.
Yeah,
basically, it's a cohort.
We talk about us being actually Siamese twins soon, I think is what we're going to do, but we're also our own little cohort. we are becoming the same person.
We are. A lot of places, in fact, as an example, I was just over at the district court, the second floor of the courthouse there, wanting to work on a reopening plan, and they asked me to come over and help them out, and they are staggering shifts, but they're always staggering the same people on the same shift, so that if one of them becomes exposed and both of them are gone, they still have the other shift they can split up to be opposite one another, and they aren't just completely out of shift.
Yeah, and they're not infecting multiple shifts and multiple people. Awesome. And it helps with contact tracing. And then minimizing non-essential travel. We had somebody already ask, I miss my family. Can I visit them? Especially we have Mother's Day coming up. It's a hard question because really we are still under the mass gathering limitation of 10 people or less. So ideally what's happening is if you are going to visit anybody, you still practice the same good rules. I mean, if you are going to be around somebody who is one of those vulnerable populations, they have heart disease, they have cancer or whatever else, then you might consider everybody wearing a cloth face covering during most of the interaction, not at dinner, of course, but and trying to stay 6 feet away. Now, we really would discourage people gathering in more than 10 groups because it's kind of illegal right now. So we really don't want, it's not just kind of like, one explanation is this executive order from the state. People have asked, is this a law or just like a really strong recommendation? It's actually a law. At a time of an emergency declaration, executive orders are law. So technically people can get into big trouble for these things, but we also understand like what's happening. So if you do visit family, be very careful when you do it. And wash your hands a lot. Don't touch your face. Don't touch your nose and mouth. And just be careful because it's not just about you, it's about them also. Then we talked about practicing good hand hygiene, avoid touching your face, and the symptoms. If you do go and visit anybody or if you go anywhere, please don't go if you are sick at all, like if you have a fever, if you have a cough, sore throat, shortness of breath, and then they've added other symptoms like headache, chills, aches, fatigue, loss of smell or taste, or a change in your smell or taste, and nausea, vomiting, or diarrhea that's not explained by your in-laws cooking or something like that. So I can say that, right? I'm just joking. Hi. No, my in-laws cooking is really great. Okay. Okay. So yeah, people. So don't take that risk of exposing others. So, people would say, okay, check in. Oh, and this is another thing we've talked about too, is just check in with each other frequently, because we know it sucks right now still. It's not wide open by any means, and people are still not able to work in some instances. So check in with each other, text, make sure your neighbors are fine or your family members are fine at this time. And this thing, yeah.
The vulnerable one?
Yeah, or the long one. Or do you want to do vulnerable one?
No, the local one's fine. So we are asking several different sectors as we go through this to keep a log, or we encourage appointments, we encourage reservations. This is again for contact tracing, which is if someone comes down with someone comes down with COVID-19 and we need to trace back all the people that they may have exposed, then we definitely need to know where you've been. And so for example, if you go to church and you sign in, if you have a slip of paper that you need to put in a plate, or however your church decides to do that, if they decide to do that, and someone comes down with COVID-19 and we need to know who all was at church on this day, then we can go through and we can see everyone that was there, and we can not keep track of them, but we can keep track of their symptoms. We can make sure that they don't develop symptoms and need to be isolated. Some close contacts will be quarantined, and I know that a lot of people are calling what we're doing now quarantine, and that's not the case. What we're doing now is socially distancing, and quarantine is different. Quarantine, if you talk to someone who's actually been in quarantine, you'll know that it's much, much different. You can't go anywhere. You can't go to the grocery store. You can't go to the pharmacy. You can't go anywhere. You are truly on your own. So we don't want to have to quarantine people, but if you have been exposed and we need to quarantine you for 14 days just to make sure you don't get sick. And if you don't get sick, you're free to go out your merry way. And if you do get sick, well, then we'll have you tested, and you test positive, then you'll have to meet the recovery criteria. And if you test negative, then you're again free to go on your merry way.
Yeah. And we really hope that people, one person asked about can they do an overnight trip to Oklahoma? They miss their grandbabies, and there's no kind of quarantine upon return. Is that correct? And the answer is there isn't a mandatory quarantine.
No, there's not.
And so the biggest thing is, are your grandbabies, are they going to work? Are they, no, I'm just kidding, but are they being exposed in other places? Are they in daycare somewhere? That might be a thing that might influence whether or not you need to kind of quarantine yourself when you get back. Are your grandbaby's parents, are they in a high-risk job where they're close together with other people often? So there's a lot of things that come into play with trying to figure out if it's safe, and if it is safe to travel, what you need to do when you come back. A lot of it isn't mandated, but that's where we're requesting, and we're really hoping that people decide to make those good decisions themselves, and figure out whether they need to quarantine or not. And when in doubt, call us either while you're there or when you get back. Sure. We'll help work through it. Like, oh, no, nobody in your family, they've all been working from home, the kids are homeschooled. Great. Just be careful. Watch yourself for symptoms, that kind of thing.
Yep. Do we want to answer some of the questions?
Oh, sure.
There was a question about going to the dentist in a different county, and if you come back, is there anything specific that you need to do? There are no travel restrictions within the state. So it would really truly be the same as like what Jennifer just described. We're hoping that at the dentist they're practicing good hygiene, and they're generally wearing masks to protect you from their droplets, and so I would think not really anything really you need to do. It would be really not much different than going to the doctor. So through all of this, I think we all need to be aware of ourselves. When you're not feeling right, when you're might be sick. So So just pay attention to that, and that's gonna be probably the best thing to do during this whole thing.
Yeah, absolutely. But thank you for asking, because we want to make sure that people feel comfortable. Like, we want you to go to the dentist if you need to go to the dentist. One question was like, had to do with dentists, like, why are hair salons closed but pet grooming and dentists are not? It's a great question. Like, we really had hoped that the state would allow hair salons and barbershops to be open during this phase, and unfortunately they're not. And we believe it's because of the close proximity of people cutting your hair. Sure, they're probably behind you most of the time, but not necessarily all of the time. And so we really want to make sure that everybody is able to stay safe. And being that close, really, even with a mask, that does put you at a little bit higher risk. So pet grooming, since we are trying to, keep as objective as possible in this whole thing, because pet grooming isn't technically person to person close contact, it's like dog to person. I don't know what else you're grooming, but maybe you might be grooming other things, but it's usually dog grooming, And so if the groomer is in close contact with the dog, we still would recommend everybody being safe, but we are not seeing transmission from dogs at this time, just pet tigers apparently at the zoo. So, but also, like, let's say you have your tiny little dog in your purse, which, I'm not a tiny dog person, but it's all right. It's all right if you are. And again, feel free to chime in if you're a tiny dog person. We still love you. But let's say you have your tiny dog in your purse, but you're hacking and coughing and yada yada. I would hope that you would decide that would not be the best time to hand your dog over to Shirley Freeman and say, here, make my dog pretty, and I just coughed all over it. It's still all about safety. So if you've been sick and potentially you're coughing on the pet carrier or whatever else, wait until you're not sick, and make sure that you're keeping the people that are trying to provide these services for you, that you're keeping them safe. So pet grooming and dentists, I mean, we have a lot of things that have been put off because the dental world has been put on hold, and in really a lot of the medical world, they've been one of the only things to be put on hold. And so we are happy that the dentists are able to be back, and they've got all kinds of crazy cleaning like going on, and masks and everything. I mean, they have state guidance. They have their individual offices are really doing a great job. So I believe that they're going to keep everybody safe through that.
I had a question on the reopening document earlier today, and I thought it was a good one. In a couple different places on our document, it says the number of people allowed in a facility at one time is dependent on the ability to maintain social distancing, and that was our way of saying, if you have a big space and you can have people, I think we used it in like a salon setting or what else? Dentists, medical, things like that. If you have a big enough waiting area where you can see 5 or 6 people and keep them apart from one another, then do it. But if you have a really small space, don't allow that many people in at one time. Because originally we had written it that, you get one person per provider, but we thought, really, they could have more. So we just want it to be the safest way. So if you've got a big space, you can have more people. If you have a small space, smaller people. Or a smaller number of people.
Or lots of small people, 6 feet apart, really. I mean, if you can collect that many. And you can borrow our children if you'd like. If you need small children to small people. Okay, so I am going to take a tiny little time out, because we know that this time is a time of uncertainty and a time of people just not knowing what the future looks like. Especially now, we've just moved into where we spent 4 weeks in the stay-home mandate, and now it's this whole new world. But what does that mean? It's good, but it also poses some challenges. Does that mean that we're going to see a lot of new illnesses and all that? So we know there are fears. We know there is uncertainty. We know that times like this bring out the best in people. We have seen such great things. We know that it also can bring out some other things that may seem like challenges, may seem like questioning, may seem like, again, a way that people show their uncertainty and their fear. So the timeout that I'm saying right now is, we see people arguing on our text feed right now. Please be kind to each other. That's all we're asking. Spread love, not viruses. That is one of our themes. But, Destiny and I, we know that you guys, everybody means well, and we hope that you know that we mean well. And so we have realized that we are we cannot actually be 6 feet apart during these, and also project, even though we're very loud people. We can't project to get our messages across, and our job right now is to inform people as much as possible. And so we're not wearing masks right now so that you can hear. We will wear masks before and after, as we always do. And so please just be kind to each other. I think people just have questions, and people don't know and want to know, and that's what we're here for, is to help each other out. So hopefully we can move forward, keep asking questions about whatever people want to know about, and we will answer them all. So, all right. Let's see. Oh, some offices will not see you if you have any underlying health issue. That isn't the guidance we have right now. If that is the case, we haven't seen it.
Well, and I don't know.
I mean,
what
medical
offices?
office or dentist?
Yeah,
dental
it makes
office,
it makes a difference probably what kind of offices.
Alrighty. And thank you guys. Very nice thoughts. Oh, I saw somebody mentioned, like, for their job they have to go around checking meters, and they can't necessarily wear like a mask gets in the way. Really, let's say if you're out walking and you're not with anybody else, or you're out for a jog or whatever, we wouldn't expect you to wear a mask then. Or if you're checking meters and you are out by yourself outside is kind of the key. We are far less likely to be spreading germs and spreading droplets if we're outside, and so that's why outdoor activities have been encouraged through this whole thing. So if a mask interferes with the job you do, like, we don't want you to be like, I can't wear my welding mask because I have to wear this cloth mask. That's bad, and bad things will happen. So, so please, use that kind of guidance. But we would like people to wear masks if at all possible. But we understand when you're outside and you're alone, or if you can't do it for your work.
Yeah. And Carrie, that makes a lot more sense. She says it was dental for her son, and so I would think that as long as it's not an emergency type of situation, that we wouldn't want someone with underlying health condition just to go get their routine cleaning or whatever. It's just for his own safety. So yeah, I definitely think that makes a difference, because we don't want medical providers turning people away. Or, well, dental providers are medical providers, but you know what I mean, like primary care physicians and stuff.
Alrighty. Okay, guys, just a reminder, please be kind to each other. We're just trying to do our best here, and I think everybody else is too that's listening. So we will continue to answer whatever questions we have. We mentioned Oklahoma.
I think we
got all the right number at home. Okay, we're just like, we have, so you don't see this, but we have papers all over because we just want to make sure to give you guys the best information possible. And there's so much that happens from week to week that we can't always keep it straight. And so we've got papers everywhere. We've got stuff everywhere.
Quick, like, at a glance thing?
Oh yeah, it should be right there.
Oh.
Yeah. It's not in color.
I was thinking it was in back.
Sorry.
So this isn't in color, but we have it on Facebook. This little guy right here. And it shows very, very briefly how what's open and what's closed. It's pretty well circulating all over Facebook, so I'm sure you guys have seen it. But I just wanted to be really clear that it is just a summary. So like it says, restaurants are open, which they can be. But it's not like it was back in December, where you could just walk into a restaurant and sit wherever you want to sit and mingle around. It's a little bit differently. It's a little bit different. Things are being done in a very, I think, what's the word I'm looking for?
If it's vigilant.
No, it's not.
Vigilant.
It's not vigilant.
What's our other word before? No, I'm just kidding.
I can't think of a
trying
word.
to throw it in there.
But I mean, like, people are being very...
like a systematic way?
Yeah, things are being done in a
that's
very
good.
systematic way. They're being done in a very specific way, just to keep, droplets away, because we know that you can't wear a mask when you're at a restaurant. That would totally defeat the purpose of being at a restaurant.
Especially, like, unless you had, like, you snuck the straw in for your margarita on Cinco de Mayo. All I'm saying is it's Cinco de Mayo, and man, it's okay. Have a margarita. It doesn't kill the virus. We've checked. doesn't work. There was a question about if a person is asymptomatic, I assume the temp check would be normal. Yes, usually asymptomatic means everything is normal. And so they have no fever, no cough, no shortness of breath, no nothing. They're walking around and they would not know that they were sick. So, even if like they themselves would probably be surprised to know that they had been exposed to the virus. So that's why you're also going to see when you go to these businesses or you go to restaurants, you're going to see people asking you, hey, have you had a fever or any of the symptoms of coronavirus that we mentioned earlier? So they'll be asking you that, and that's, for one thing, it's to kind of raise awareness that, hey, if you do have any of that, you probably shouldn't be dining at a restaurant. And number two, if you do have any symptoms, then that will allow people to kind of help and say, okay, well, let's get you somewhere to try to figure out how we can find out if you need to be tested or whatever. And not necessarily everybody who is sick has COVID, right? And not everybody needs to be tested. But it probably means that the next step is that you go to your doctor or you call your doctor and say, hey, this is what I have going on. What do you think I should do? Mm-hmm. So. I think there was another one. Oh, I know. As far as records, so let's say you go to to a restaurant, and they might ask you, hey, what's everybody's name that's in the restaurant right now? Or in your party right now. So you list off 4 people. These are our names, phone number, yada yada. They'll write down the date and time where when you were there. And so the whole reason for that, again, is really, we were joking earlier about being up in everybody's business. We really don't care, except the only time we will look at any of those records is if there is a positive case that if Destiny says, hey, I was out at this restaurant the other day, and it was this time, and yada yada. So we can look at their log and say, oh, these were all the people that were at the restaurant at that time.
That brings up a thought.
Yeah.
I don't think it would be a bad idea for people to be writing down where they go. Mm-hmm. We will go back 16 days. So if someone called me and wanted to know where I had been in the last 16 days, I could not honestly remember what day I went to the grocery store. And I could not honestly remember, most days it's working home. But
she can't remember much.
I can't remember much. It's just work home. But I can tell you the base people that I've been around, my cohort of people, but I plan, because I haven't started going out yet, because I am nervous too. I saw someone comment that I am nervous as this starts opening up. I'm nervous too. So I plan to get one of those little spiral notebooks. They come like 4 for $1 or something, and then just put the date and kind of write it down. Takes like a second. But that way I can be sure that I can tell people where I've been if they ask.
I love it. And carry a pen with you. Did you say that?
Oh, yeah,
no,
I didn't say that.
That was her idea the other day. Always carry a pen.
Carry a pen. So then you don't have to touch everyone else's pen. You can just have your pen.
Yes. Awesome. So Destiny was talking about those records, that we keep of people and, or that businesses businesses will keep of visitors or restaurants will keep of customers. After 3 weeks, they just shred them. We will never look at them. No one will ever see them. So again, just letting you guys know, as we have, hopefully this whole time, being totally honest and transparent, we really don't care where people have been, but we do care about if that turns out to be a source of infection or a source of spread in our county. So we just want to be able to help everybody in an easier way.
Yeah, we just want to be thorough in our contact tracing.
Do you have to have a fever to be contagious? Absolutely not. And that is exactly why it's so important to wear masks, because again, that same person that we talked about that doesn't have a fever, doesn't have a cough, would be surprised to know that they had the infection or were even exposed to it. Those are the people that can also spread it. You don't have to have any symptom to be able to spread it, because that virus comes out in your droplets. Your droplets can come out, like sometimes I spit when I talk. I started wearing those Invisalign things, so I need to go to the dentist again soon myself. And I spit all the time when I'm wearing them. I'm not wearing them now, but so droplets come out all the time, and so it's possible to spread it to other people simply by talking or sneezing from allergies or whatever else, and you'll just kind of you could potentially never know that you had it. So when you wear your mask, that is where you, as potentially an asymptomatic carrier, I mean, you're quite the asymptomatic character, I tell ya. But if you're an asymptomatic carrier, that is exactly what we're trying to prevent the spread of your droplets. And if we each do that, then everybody is preventing their own droplets from being spread to, like, the tomatoes at the grocery store, or the hammers at the hardware store, or the whatever else at the Dollar General. So then we can all protect each other. Oh, that's my brother-in-law. Nope, COVID is not spread by farts.
That would stink.
Oh, good one. Awesome. Can we
Overspray.
To overspray? Yeah.
Mind the overspray.
Mind the overspray. And like close talkers, this is not the best time to be a close talker. Like, don't really be up in people's business.
There was a question about garage sales. Did we put them?
We did in community events.
Community events. So probably not till phase 3.
So that would be earliest June 1st for garage sales. And they still, around here, you probably don't have garage sales of 90 or more. I mean, unless you're really good and have good stuff, in which case call us, because we'll come by
there.
first. But yeah, if it still has, all of this still has to go by the mass gathering mandates.
Yeah.
Do you want to talk about sports practices? I think that's kind of come up a lot.
Yeah, we're not 100% sure. I found out that I misspoke Monday, and that wasn't what I was told. I said the wrong thing.
That's okay. We're starting over. Redo.
Whole different day. Sorry, Jace. We are not, the governor is not allowing any sort of rec sports until phase 2. Mm-hmm. But we are allowing, like, sign-ups. So
mm-hmm.
if they want to start by phase 2, they can get signed up now. Mm-hmm. Sports practices are going to be really hard. Like, we have talked through this with a lot of people. Mm-hmm. For sports like tennis, where you can limit the number to like 4 or something, it's a lot easier. Golf will be a lot easier. Baseball and softball are going to be really hard because there's so many kids on a team, and you've got dugouts, and you've got kids going back and forth, and it's going to be difficult. And we're still working kind of through all the details. I know that one suggestion was that the recs not buy the T-shirts for the teams, and then they just let them play for free. There's been other suggestions where you only do inter-county play, so Fredonia and Neodesha would play, and
that would be it.
I don't know that Altoona has rec sports. I think they play in Buffalo, so we could play Buffalo. But and no like big traveling leagues. It's really gonna be.
It'll be tricky, but
it will be tricky.
But it's doable, hopefully.
Yes.
And we will find out, because also it might be, let's try it, and if it really sucks and no one's having fun, and it's then maybe this is not the year for rec sports. Like, we don't want to say that, but we're gonna try. And And our motto through all of this has been, like, let's see how we can make it happen, and make it happen safely, not let's see how we can shut things down. Eric, we must have missed that message, because we've been trying to do a really good job of getting messages, so we'll get back to you on that one.
Sorry.
And Recycle Center, yeah, I think you should be able to take things to the Recycle Center, right?
Yeah, I don't think it ever shut down.
I think so, yeah. So
I don't know that for sure, but I
don't think it did. No, I think our recycling's
Bob
going.
was on here.
Yeah. So I think we're still recycling. And in general, so we think about those people then who might handle that stuff. They're taking precautions as well, wearing gloves, wearing masks, and things like that.
Summer arts is another thing that we've talked about quite a bit. Thank you, Diane. We did lump it in with the summer sports just because it's a summer activity. Summer arts and like the
Summer reading, yep.
The reading programs that the libraries do and things. We want those things to happen too. And they're a little easier to control. The class sizes are smaller. in our document, we have limited the number of indoor class sizes to smaller than the mass gatherings. I spoke with Fredonia Arts Council today, actually, and told them that we said classes of no more than 15, and they said they never have classes bigger than 12.
Oh,
so perfect. Yeah, and they've taken out some of the classes where people had to have like kind of their hands on each other, or some of those. If you touch it, they're gonna have to throw it away, and they don't want to have to, waste that much stuff. So, they've adjusted what they're doing as well.
Awesome. And hi from Manhattan. Hi, Dr. Perry. Thanks for joining us. County Fair, end of July. Kim, that's so weird. You've never mentioned that to me before. Just kidding. Is it every day? Just joking again. Okay. No, So what we expect is if everything goes as planned, and this is why it's so important to open safely, because if we open everything safely and we open, not quite everything at a time, like not a big free-for-all, if we open everything safely, then we can go from phase 1 to phase 2 to phase 3. If we were to say, like, open everything up, everybody goes crazy, everybody spreads disease, we have a spike of 50 new cases in Wilson County, then what probably would happen is we would end up in another stay-home mandate, and we do not want that to happen. Trust us, nobody wants that to happen. And so that's why we're being extra cautious with all of this. So if things do go as planned, we'll go phase 1, or we're in phase 1 now. In 2 weeks, on the 18th, we'll go to phase 2. And in 2 weeks after that, we'll go to phase 3. And then that phase will likely last at least 2 weeks, if not more. We'll have to have guidance from the state on that one. And then the state is calling it phase out after that, where we technically go back to life as new normal, right? So we're still going to do social distancing. We're still going to really just watch ourselves for fever and not go out when we have fever or other symptoms. And so we need to just continue to be really careful. But if we are at that phase out by the end of July and we can have the fair, then absolutely. But as we put in our plan for community events, the people who are in charge of the event will be responsible for having hand washing stations or hand sanitizer, making sure there's the ability to stay spread out, and making sure that that people are doing the social distancing that they can do in something like that.
Because truly, there are 2 of us. Now, we have staff that are amazing, but as far as being able to go around and police every practice and every cow show and every, I can't even think of something else, arts program or reading program, we don't have the staff to do that, and we don't want to do that. You guys have, Jen and I were talking about this the other day. You guys have been so amazing, and the fact that we've only had 1 case so far, it's not a coincidence and it's not a fluke. Mm-hmm. It's because everyone really is trying to do the best that they can to keep everyone around them safe. So we didn't feel like we needed to be stricter than the state because we've trusted you to do it this long, and we are going to trust you to continue to do it. That You guys have been awesome.
Yes, absolutely. And there was a question about, yes, we'll all give hugs later on, Lori.
I miss hugging too. I'm a toucher.
Julie, the playgrounds will be open in phase...
I think it was 3.
I think it's phase 3, actually. So that
playgrounds are open.
Playground equipment will be open in phase 3.
I just licked my finger.
Oh, don't do the thing.
I did the thing.
There we go.
I caught it before I actually did it. But
so playgrounds are open, public spaces are open, but playground equipment is not open until phase 3, June 1st. And that's really because there's no entity right now that's going to go out and clean things like we have at the hospital or at businesses or at the schools, so no one's going around
or whatever,
or at gyms. So we don't have anybody monitoring that where they can make sure to clean it after kids have played. So that's the biggest thing with
I
that.
can't find it.
I think you're right. I think it's
I've looked at that document too many times in the last few days. I can't even read it anymore.
Oh, there was a question earlier on, I think Kim asked about reinfection rates.
Yes.
So that is something it's gone up and down, right? So when we first came on here and we said, don't worry guys, you get the disease and you'll be fine. Hopefully you'll be fine. And if you recover, then you'll have the antibodies and everybody will be safe. Well, then what they started seeing is that people were then testing positive after they had been in the hospital for COVID, or they had tested positive before, and then in the amount of time that they thought that you shouldn't test positive anymore, they were testing positive again. So we thought, oh my gosh, people are getting reinfected. Like, what's the deal? And they were seeing that some people weren't developing the antibodies that we thought that they were going to develop. So now we are seeing studies that say, well, maybe those positive tests were really RNA, that is particles, like part of the virus, right? That is still in the body and triggering those positive tests for COVID without having an actual new infection. And so our long story short is we don't know, because we're not sure. And I think we need a lot more research for that to figure out if there is a possibility of reinfection rates.
Another thing that just kind of demonstrates the lack of knowledge about this virus is the recovery criteria has now changed.
Good point.
Before, it was 7 days and 3 days without a fever, whichever was longest. No.
Yes, whichever was longest. Or you had to
have both.
Yeah.
Yeah. So if you were only sick for 7 days and you were 3 days without a fever, that's fine. 7 days was fine. But you had to have at least 7 days. Well, now they've changed that to 10 days. So it's 10 days from the day that you start developing symptoms until either 10 days or 10 days plus 3 days without fever. So it could be longer. So again, that's just another example of how much we don't know.
Yes, and so we're trying to give you the best guidance with what we get as far as information, and that just changed this last week. Of the criteria for recovery. How many cases in this area? So for Wilson County, we just have the one, and it's recovered, and that one was good and recovered. So even with the new criteria, it was still recovered. So and then,
that one's not infected anybody else. So.
And then in this area, it's kind of hard to say because
if I had better internet here, I could look it up for you in like a second, but I don't. Just suffice it to say that there are active cases in every county near us except for Elk.
Yes, right? Well, what about
Allen.
Oh yeah,
Allen is the next closest, but it's a couple counties away.
Oh, that's right. I always forget. Destiny's really good at like county geography, way better than me. So,
just this corner,
just the one corner.
If you get past Wichita, I have no idea. If you get north of Allen, I have no idea.
Let's see. Very few are wearing this. So another comment about masks, and we kind of touched on this at the very beginning. Please, if you are in any type of network, churches, businesses, your cohorts, your neighbors, your family, we're asking each of you, and we know you guys are the ones that are wearing them probably, right? So we're asking each of you to reach out and just say, hey, I would love if you would wear a mask, or whenever you go out in public, because we aren't seeing nearly enough. We know even over the weekend there were probably even less than before, and we heard that across the state because people were like, yay,
it's over,
we can do whatever.
Yeah.
But you know, we all know better that this is one easy way that, although sometimes uncomfortable, it's one easy way that we can protect each other from the spread of coronavirus.
Yeah.
What else? Let's see. Wandering around masks. Good evening. How many cases? Okay. Well, I think we're getting close to the end of the questions, unless other people have questions.
Yeah, we'll do last call.
Last call for questions. We really do appreciate everybody, sticking with this, because we know it's not easy, and it'd be great if we all just said, hey, let's just go back to the world as we knew it. Did I already mention it's Cinco de Mayo? I mean, really, like we should all be bellied up somewhere with margaritas and tacos, and that's just the reality of life. But there's no alternate universe, and so what we are dealing with is this challenge that we're all facing together. And just remember, the virus is the jerk. It's the one that we're all battling together, and we're all protecting each other from. And so we want to continue to do that. And we can cuss at the virus, we can be angry at the virus, and that's fair game. It is a jerk. But let's be kind to each other and help each other and check on each other. I think there was another question.
So play dates. Play dates are another one of those things where we just need to exercise caution. I know that these kids are getting cagey, and I know...
Do you have yours in a cage? Is that a word?
They think so.
Okay.
They think I have them in a cage, but they're getting cabin fever. Not that they haven't been outside, but they want to see their friends, and I know that they want to see their friends, and I've begged mine for 2 more weeks. Like, I'm just like, please,
Yes.
2 more weeks. But if you have play dates, just like when Jen was talking about people visiting their relatives, just think it through. Do what is that, the 5 degrees of separation or whatever from everybody. Think about where everybody may have been. Think of their parents and where their parents have been. If they've been at home working from home and the kids have been working from home and you guys have been working from home and all that, it's probably not going to hurt anything to get a couple kids together. Mm-hmm. Just be careful. Maybe don't, let them lick each other's faces or whatever.
If you were doing that before anyways,
don't do
then
that
we probably
anyway.
need to have a discussion.
But do, maybe do play dates at the park where people can spread out and you're not
confined to one
in one room, or get a friend and go on a nature walk, or something like that where you can get some air between you and just a little more safer.
And lots of hand sanitizer. And then just dip them in hand sanitizer before and after, and maybe during, and maybe just spray them the entire time also, because they're children, and that's sometimes what we need to do.
Only don't really do that.
Only don't do it. Because like hand sanitizer is like 60% alcohol, I think it has to be. So that could be bad. You'll have tiny drunk or poisoned children running around. All right. Okay, we have a long one that we have to do a lot of reading. Okay, let me just, how about we read it?
Yeah.
Matt asks, would like to hear your thoughts on the epidemiology of the massive rise of asymptomatic cases. A plant tested all of its 2,400 people, 92 tested positive, and none had symptoms. This is the main reason why all the packing plants are shutting down to eliminate workspace liability. So, I would say the first thing is what we believe is that there have always been a lot of asymptomatic cases.
That's going to be my answer.
Oh, good. See?
That's going to be my answer, too. We didn't even talk about this.
Do you see the brain things that are going between the two of us? So there have always been asymptomatic cases, but our testing has gotten so much better. Like the meat packing plants, they just got an influx of tests because we actually got them from the federal government because the governor said we need this testing now.
And the reason we needed that testing right now is because Kansas supplies so much of the nation's meat supply, and so they wanted to make sure that they could continue to work. So it was a huge, massive. I think the testing rates in those counties are like 30%.
No, I think they went up to like 50%
Were
in
they?
Ford County.
Yeah, and we're something like 12.
12%. Yeah.
So they were testing asymptomatic people, which means they'll get asymptomatic people who show up positive.
In the rest of the state, we're right now, like as of right now, although we're seeing it change as we speak pretty much. Right now, we're only testing symptomatic people, so that's going to be the difference. But sorry, go ahead.
Yes, no, absolutely. I think maybe not here because we haven't been seeing symptomatic cases here,
to warrant a whole bunch of
asymptomatic testing. But if we do start seeing cases, I would imagine. And this is, again, just a guess. I would imagine that if we just tested everybody, we would end up with a lot of asymptomatic cases as well.
So the important thing you'll see also is as these numbers rise, like we're going to have a lot more positives in our state, and we're going to have a lot more negatives too. And so one of the things that we really want you to watch is like the percent positive, because if we're doing a lot more testing, it's not fair to say, okay, well, we found all these new positives. Well, yeah, but we also found all these new negatives too. And so that's an important distinction to make. The absolute number of tests that are positive versus like the percent positive of all the tests that are being done.
There's still plans of mandatory testing if hospital employees?
Right now, I don't believe we have mandatory testing of hospital employees. And again, these are things that develop. If we start seeing more cases in our county, then that might be something that we go to later on. So, and yes, Dr. Price in New York, Dos Equis might be a better choice than Corona at this time, just to stick it to coronavirus. Take that, you jerk virus.
Yeah, and Cassie threw a nice statistic up there that we have 34,634 negative tests as of today in the state. So I don't
So we're doing a lot of testing.
Yeah, we're doing a lot of testing.
Oh, I guess here's our cases. So 5,000 positive cases, 5,400 positive cases. So again, Kansas was really sucking at their testing rates, our testing rates, and so we were able to really ramp up testing. I mean, really, just in the last week, really the last couple weeks, but definitely over the last week. So our numbers are getting much better, and the more we can test, and this is really even just testing symptomatic people. Like in Wilson County, we mentioned before that nobody is just being told to isolate if they have symptoms. We're testing everybody that we suspect of COVID-19. So as we see more testing happening, especially in the urban areas or in western Kansas where they're seeing outbreaks, then yeah, you're gonna see more and better numbers of testing rates and more positives come along.
Mm-hmm. And positives are to be expected when we start opening things back up. When we start moving around more and we are putting more people together, then the odds of us getting a case are high. Our odds are very high of getting a case, and we do expect to get cases. We just want to get them slowly.
Yes, and we're ready for them. Our hospitals have been ready, our clinics have been ready, our health department's been ready since the beginning of this. Can you believe it? We've been at it, as of tomorrow, it'll be 2 months. COVID-19 came to Kansas on March 6th, and so we've been at this for 2 months, and we know it's been a long 2 months for everybody. Yeah. So, and when we talk about, Destiny's talking about with her kids, give it 2 more weeks, before you go out and do play dates. The reason we say that is because this is a new phase in life. We're opening up new stuff. Let's see what happens before we say, okay, everybody have play dates. Maybe just be a little careful. We know some businesses aren't opening right away, even if they can, because they want to see what that looks like when things start opening.
Yeah, sort of test the waters.
Love it.
Yeah.
All righty. Thank you guys for this super nice.
You guys' comments are so nice.
And we will say, we do not take your comments lightly. This has been hard, it's been very challenging, and we only say that because we want you to know we're trying to work our hardest for you, and so everything, all the nice stuff that you guys say is really taken to heart, so thank you so much. Now, we're not saying you have to say nice things, but if you wanted to.
But say nice things.
But say nice things, yeah.
I'm just kidding.
Destiny, I found out, cries a lot, so.
I do.
Yeah, so don't say such nice things that you start crying, or you make her start crying, because then it'll just get
Don't
weird.
buy me Starburst. Oh, God.
So
I had a rough morning with online school, and I'm completely transparent. I had a rough morning, and Kara, bless her heart, brought me Starburst, and I just started bawling.
Yes, but I will say, and this is our common theme for schools is reach out to administrators, because we've already got a solution for Destiny for this afternoon.
Mrs. Camacho called me right up. She's like, "What's going on?" and fixed it as well as she could, but fixed it to where I can help fix it too. So I think they really are trying, and it's not easy for anyone.
Yeah, absolutely. See? Okay, she's not crying, guys. We're fine. We're fine. We're good. We're good.
It's okay.
Okay. Wonderful. So we're going to shut her down. If you guys have questions, just like always, please feel free to comment here or send us messages. And we know there will be lots of questions as things go along.
Yep, and Eric will get yours right after this, promise.
Yes. As always, check on each other, be kind to each other, spread love, not viruses, and we're all in it together. So not a single person is doing this on their own. Sometimes it may feel like it, but
if you do feel like you're doing it on your own, reach out to someone. If you feel like someone feels like they're doing it on their own, please reach out to them. Let's be there for one another.
Yeah.
From a reasonable distance.
From a reasonable distance. Okay, you guys, thank you so much. And thank you for always tuning in. We really do appreciate it.
Yep. Thanks.
Love you.
See you next Tuesday.
Bye.